9 o'clock in the morning. Welcome back. Monday morning. Wow, there's been a lot of conversation in the past couple of hours. First of all, somebody called in. They asked me a question about Father Mike Chrysostomo and how the voting went. He told me for the Lumen Christi Award, he was 51 votes behind Texas, but Texas was number 1. So Guam is number 2. We are in the top 10 finalists, and then it goes to a bigger national audience. But no more public participation is necessary for this next round to select a winner for the Lumen Christi Award for 2016. So he wanted to make sure everybody knew that that he was 51 votes. In the studio, you see me waving. I'm waving off Kevin Kerrigan, who is very familiar with these parts, and he's going to leave in my care. I never get to say that about doctors, but I am today. Dr. Erica Sanford Kobayashi, who is in charge of the pediatrics department at the Guam Regional Medical Center. Let me pull my chair down. Do I feel tall to you? Because I feel really big right now. Okay. And then Ana Milena Sanchez Varela. Nice to have you in the studio. She is a pediatric hematologist oncologist. And you are a pediatrician, Doctor. Can I just call you Erica?
Sure.
And can I just call you Anna?
Yeah,
no thank you. It just takes away all the Kobayashi so much longer than Erica. Welcome here and welcome to Guam, right?
Thanks for having us.
Yeah. Now both of you GRMC doctors, you were hired out of California, were you?
Yeah, San Diego.
Okay. And Anna, Dr. Anna, you were?
Florida.
Yeah. Okay.
Florida.
Wow. What a long way, huh?
Yeah.
Is it? Can I ask you to move those microphones a little bit closer?
Oh, sure.
If you could scoot in, or you could actually pull the whole thing towards you. There you go. Okay. So everybody can hear your voices. Well, you're on television, in case you didn't notice.
Oh.
Yeah. Now turn around and look at yourselves up in the Yeah. Look at that. See, the thing is, I walked in the door and I looked at them. I said, "You guys look like high school students." I mean, really, I'm hoping that's a compliment.
It is.
Because you do really look very, very young. So, you know.
We're both in our 30s, but the hair dye helps.
Hey, I'm in my 50s.
Right here.
I'm in my 50s. Tell me about it. Kevin, I almost called him Doctor. Kevin Kerrigan was just telling me that you guys are both also married to doctors at GRMC.
That's correct. Yeah, my husband's one of the ER doctors.
Okay, and your husband?
My husband is a pulmonologist and ICU doctor.
You know, the funny thing is, it's like you guys come in pairs like this. It's like Noah's Ark unloaded on the Guam Regional Medical City, because you weren't the first, couples doctors to be there.
No, you're right. There's a lot, actually.
Dr. Marion, she's and her husband both are doctors. So. Are there any others? Are there any other couples? There's 3 so far.
Let's see. 2 of the CRNAs are a couple.
Mm-hmm.
Am I missing it?
Maybe
doctor nurse. There's a couple of
doctor nurse relationships. But you guys, is it okay? So these are relationships that happened before you got here.
Yes. That's right.
Okay. It's kind of cool to pair up with another doctor, right? I mean,
it helps because they understand what this being on call and the demands of the job, so it helps.
The demands of that. Do you also have children yourselves?
Anna does. I have a 5-year-old girl, and I have a 3-year-old boy.
Okay. And how about you, Erica?
Oh, not
there yet. Not there.
In the next couple of years.
Okay. Well, the children's pediatric care on Guam. Challenges, observations, differences, contrasts, anything that compares to where you were before?
It's definitely exciting. I think a lot of the differences we notice are that certainly depending on the population, we'll see people present to care a lot later. So they'll bring in their kids when they're a little bit further along in the course of their disease or their illness than I was used to in San Diego, where the sniffles, mom comes in that same day, or the first day of the rash, and here a lot of the times we see people come in weeks into their illness, and so they can be a lot sicker, and so that's been certainly a challenge, but also really interesting for us.
Yeah.
At the same time.
Have you found any of these sort of lingering situations like that where parents don't necessarily recognize something about their child and then it's been revealed on by the time it gets to you, unfortunately?
Yes, so we've seen a little bit of that. Also the pathology is different. Some of the infectious diseases, some of the congenital diseases we're also seeing a lot.
Oh, really? What are you seeing here that you haven't had to necessarily deal with in the Florida community?
We have osteomyelitis, which is something that infection in the bone. We saw one patient with that was a little bit advanced as compared to somebody that will be in Florida. Also, some familial diseases, because I deal with blood diseases. Right. So a specific disease that I haven't seen in other that I heard of before, but that we saw here actually in a family. So some of those congenital diseases that maybe were not diagnosed before we're seeing. So
is it something by the time I make the point about by the time it gets to you into your specialty, it's already something that might have been existing but never had been diagnosed? Is it fair to say that? Or
occasionally, not every time. Okay. But yeah, occasionally there's some things that are linger. But some things like for pediatric hematology and oncology is like so acute, like let's say leukemia, then you have to go. The symptoms are just fast, and then you know that something's wrong. So patients have to get to the hospital. So in that case, it's like kind of right away.
That's actually, I mean, that is so specific and specific to children. Your job, and so what has been the need that was recognized by GRMC to have your specialty in their hospital?
Okay, so I guess the mission and the goal of GRMC is to bring specialty care to the island. So specialists that were never here, like they're done for the adult services, and we want to do it also for the pediatric department. So we're bringing specialists that we never had in Guam before, like pediatric cardiologists and pediatric hematology and oncology. So just to bring new specialties that never happened here.
Yeah, but was there necessarily a need for it as much as did you already have patients at your door?
Yes.
And were they quite a few patients?
We have some patients, yes, with hematology and oncology is like so broad. It's things like from as simple as like iron deficiency anemia, when maybe there's a deficiency on your intake of iron and you develop anemia, or so complicated as like a leukemia. Some of those are a little bit more involved and includes a lot of supportive care. So it's just the wide range. So also bleeding disorders. Actually, for hemophilia, the bleeders. I know there's a community here in Guam.
There is,
and the incidence actually is higher than in the States. Because it's a congenital disease, something that is transmitted to families. So there's a hemophilia, like the incidence a little bit higher here in Guam.
Yeah. So. I was going to ask you a question, and I plumb forgot what. Jaundice in babies when they're born, is that also something that's prevalent not only on Guam, but I see that quite a bit. Is that sort of a normal occasion from both of your perspectives? You can jump in anywhere you want to, Erica. But.
Well, I don't feel like we've been seeing more of that here than we do at home. It certainly can be higher in an Asian population. That is one of the risk factors. Also, babies that are born a little bit earlier, babies that are breastfed, which we still love. And then, certainly babies with blood types that are incompatible with mom and baby. So, like if mom has a different blood type than the baby has, there can be some jaundice from that. I don't feel like,
but it's nothing out of the ordinary.
No.
Because a lot of people have babies that are sitting under lamps. I see the pictures of them on Facebook. It's like, oh, my brand new baby, and they're under a lamp at home.
Yeah, there's so many risk factors for it that it's decently common, just kind of everywhere you go.
Yeah.
But certainly very fixable, very treatable, as long as we are. Aggressive about
Talk to me about the pediatrics unit. I haven't had the occasion to go up there for obvious reasons, but
we're lucky. We have a great team. Like Anna said, we have regular pediatricians. We have a pediatric cardiologist. We have Anna. We have an intensivist now. We have some wonderful nurses. We're very lucky. We do have the regular pediatric floor, which is on the 4th floor. which I think is a nice space. We put in a playroom. We try to make it as, not scary as possible.
Well, yeah. Did you when you were hired to lead this department, did you get your say? I mean, you got to go up there and just sort of redo everything or do everything because there was nothing there.
It was already built for sure and designed, but it was actually really fun, and certainly Anna was a big help in this. But we got to order the supplies we wanted, the stuff for the toy room that we wanted, the medicines that we wanted. We really got to put a lot of our own desires and wishes into that, which is really fun and also makes you more invested in it, if that makes sense.
Sure. Well, wouldn't that just by nature, just this area of medicine, pediatrics, I mean, just in its nature, do you feel a little more passionate, about pediatrics than you would, adult medicine?
I think we do,
internal medicine,
which is why we picked it. I think we do, but it's kids are so resilient. They bounce back so quickly. There's so much hope for them. Even when they're very, very ill, we've had some that really have just recovered so nicely, just by virtue of being young and healthy. And so it's fun in that way. We have a lot of success and a lot of success stories. Not to toot our own horns, but mostly also because kids just are very, very good at bouncing back from illness. Yeah.
One of the illnesses that I notice on Guam is more prevalent, I don't know if it's on the mainland, but childhood asthma or development of asthma, especially in these parts. Certainly we live in a climate that might contribute to that. Do you see a lot of patients with asthma? Is that a big deal or not, or in comparison to any other?
I don't feel like we see more hospitalizations for asthma, but in the community when we are seeing people in the ER, when they're admitted, a lot more have a medical history of asthma than I'm used to in San Diego. And like you said, sometimes climate can be a factor in that. Sometimes genetics can play a role in that. One of the things that definitely we know plays a role that we can help stop is parents or family members that smoke at home. And unfortunately, we do see a lot of that here, and that definitely contributes to the asthma.
The secondhand smoke, or just irritating, just irritating the asthma. And the other thing that I'm understanding about that, especially when you see kids in the ER like this, is because parents, after they've dispensed like their first couple of doses of the medicine, and they see the kids starting to improve, because it turns around pretty quickly when they have the ability to breathe, right? It's really a fast turnaround if you, whatever, prednisone or albuterol or whatever. Then they stop doing it, so they don't keep up with the course, right, of action, and so they drop off. There's still extra medicine laying around, and the kid comes up with another, episode or something, and then they're right back in after a week or two.
Yeah, asthma is difficult in that way, and that it can exacerbate and go away, and it's a little bit different in the sense that it's not like a bottle of amoxicillin or an antibiotic where you finish the whole thing. For asthma, you treat it for a course while you're symptomatic, and then you kind of do a little bit less frequently, and then stop, unless you're a frequent, recurrent asthmatic, and then you might be on a daily medication, but that's totally patient-dependent. So I think some parents they get used to their kids having asthma, are really good about being proactive and noticing it early and getting on top of it, and then preventing that kid from being hospitalized. So sometimes it's going to happen no matter what. And then certainly it's something that takes a lot of parent education, so we try really hard to do that, like when we capture them.
Yeah. How do you build, a reputation just from the ground up? How does one build a reputation? Maybe probably not as hard of a situation on Guam, considering we have, we only have one or two to choose from. But how would one, when starting a department like this, sort of build up I don't even want to say it. I don't want to make it sound like you're marketing for patients, but but you have to certainly build some sort of reputation in order for you to be a choice, I guess is the best way to say that, right?
Sure.
Yeah.
So I guess you try to do the best every day, the best of your abilities, and try to invest in because we really love our job, so we really enjoy doing it, and I think that just
we're not great promoters or marketers. We just hope that by being here and doing good work, that it will speak for itself, and hopefully people see that, and we do try to try to make sure that we communicate well with primary care doctors and have those lines of communication open. But otherwise, I think that, it'll just speak for itself.
Yeah, and I'm understanding that it might have probably been a little more of a challenge for you in this point in your career, because you've now moved completely away from family and your nearby friends and all that, and into a community that's largely, is it kind of foreign to you, that know much about Guam? And then you had to sort of research who your colleagues were and try to do some door knocking, right?
It's been great, actually. It's been a great experience for us, and just that the community has received us very well, like the doctors, the pediatricians, they receive us very nicely. So that's something that we appreciate, and getting to know people, getting to know the difference with the patients and the community. It's actually been a great experience. We're very grateful.
Oh, I'm glad to hear that. How about you, Erica?
Yeah, I agree. I think that pediatricians in general are just a nice group of people, and the pediatricians that we've met on Guam have been really welcoming and really friendly towards us, and we super appreciate it a lot.
Well, and so from a consumer's point of view, what's nice is that if you have children, in the mainland, I don't know if I watch too many movies or I talk to too many people who are like from California, where you have a long list of people, and you actually get to interview a pediatrician. Guam doesn't have a lot of what a pediatrician's clientele or consumer base is by word of mouth, and it's also generational. So if you've had a pediatrician in your family for for many years until the kid's 18 years old, that's the same person your grandkids are going to go to as well.
Yeah.
So there's that. There's not a whole, we didn't have a whole lot of choices by comparison that you would shop for one.
Yeah, absolutely. And we don't do any primary care or any primary care clinic at all. The only clinic we have is Anna's for the hem-onc and then the pediatric cardiology. So we fortunately don't have to go out.
You have to compete for business
we don't
or
have
any
to
of that
compete for
stuff.
business. We just get kids through the ER, and so we don't really have to build up a practice like that, which I agree would be a lot more challenging. Yeah. But it's not really our area of interest.
What is your most state-of-the-art equipment that you have? You have bragging rights here on were you able to get any piece of equipment that you'd always wanted that you hadn't had that you were able to secure here?
So I think the advantage of being in an adult hospital that's a specialty care that's trying to bring new things to the island, that we can benefit from those things too, like the MRI machine, the CT scan, the sedation team that will be able to help with sedations because a kid won't stay still for an MRI or a CT scan, so we have to bring the anesthesia team to give them sedation so that they stay still for that. So that's part. We benefit from those things. The cath lab, I think at some point the cardiologist, maybe he can come and talk to you, but those things will benefit in the cardiology department because it's something new in the island. Because of pediatric cardiology, he also can use some of that equipment. And for the oncology part, I guess there's an infusion area in our hospital that's for the adults, but I can also benefit from the kids, right? So it's like taking advantage of what the hospital already is building, which is great and is different.
In the lure to get you here, there might have been a chip that you could play in that area, couldn't you? To be able to use use a little bit of that as in your position to get something that you wanted.
I think some of the people that are more procedure based and equipment heavy did, in terms of operating equipment or radiology equipment. Pediatrics isn't very procedure heavy and isn't very equipment heavy, so so we did not. And I think that we have wonderful equipment. It's on par with what I'm used to, which I came from a place with great equipment. But the nice thing here is the access to it is great. Like, we did never have trouble here getting an MRI when we want it. Like, at home, it can take where I was used to. It could take a couple days to get an MRI
really?
Here. I've never been able to not get it the same day. Wow. Another nice thing is that it's kind of a smaller community, and so all the doctors know each other, and so just to have a consult or pick somebody's brain or just ask for a little bit of assistance, it's really collegial, and so that stuff happens a lot more smoothly and a lot easier, I think, just by virtue of being a smaller community than
you
what
tap
we came
into.
from.
It's easier to tap into the resources. It's a small pool of people.
Yeah.
By comparison, although it feels like a large pool of people.
Yeah.
If you look at any of the directories of the doctors on Guam, we are very, care heavy here.
Yeah.
Yeah.
Absolutely. But yeah, it just feels like a small community. It feels like a team.
How do you have like a tour of duty, if you will, like a time frame that you'll be here and you cycle out, or how long is it a contractual thing? Is that how that goes?
Most of the contracts are for 3 years.
Okay.
And then you can stay longer if you want.
But so far, are you liking Guam?
Yeah.
Okay.
We're both liking it all.
Okay, let me guess. You've done diving.
Yes. Yeah, my husband and I dive. We've been to Palau.
Okay.
Everybody told us we had to go there. We dive here also. We part of the reason we came is for the travel. Guam's so close to everything. It's been so much fun for us. We've gotten to do so many exciting trips.
It's like places 3 hours. Everything's 3 hours away, right?
Yeah.
Just about.
Yeah. Even just with a few days off, you can go do something fun, which is one of the big draws for my husband and I.
Dr. Anna, what's the thing that you like about moving here?
Yeah, well, my kids love the beach, so we had a lot of time spending.
It's so different than the Florida beaches. Isn't the Pacific much different than the Atlantic and the Gulf?
Well, no, the weather is kind of the same, like in Florida.
Oh, sure, yeah.
But I guess being excited, we like it. We're originally from Colombia, so it feels like a little bit like Colombia.
That's good. Well, there's some of the foods maybe. There's a lot of
Filipino food because of the Spanish heritage.
And some of the Chamorro food. And some of the Chamorro food.
Correct.
Well, it's a mishmash.
It's a mix.
Yeah, it certainly is. It all roads lead back to Spain for some reason or another.
That's correct.
But anyway, I appreciate you guys coming in. Thank you so much, Erica.
Thanks for having us.
I hope I see you around town.
All right.
It's small enough that we could do that.